Hey, what's up, Sandy?
Oh, Michael, remember last week I told you I was going to prepare this whole beef tenderloin? Seems like we're always talking about food. Okay. But I do love to cook and I love to entertain and have people over and all. I called the butcher. His name is Eddie. Hey, Eddie, do you have a 4.5 to 5 pound tenderloin? I'll find one. See, I like Eddie's attitude. When people call dental practices, that's what the team members need to be like. Okay, we can do it. I'll find one. I said, can you trim it up for me and tie it? I'll do it when you want to pick it up. Made right in. And I'm like, yes, this is a great phone call. Eddie is good. And so I picked it up, brought it home, and I prepared it. And it's the best ever. It was fantastic. And that's what I served on Memorial Day.
Nice. Okay, that's good. I like that. I like how I'll find one. That type of
Yeah.
attitude. And in this episode, we have one and only the Megan. Let's go, Megan.
It's going great. Thanks for having me.
Thank you for coming on and finally busting these myths that we have been getting constantly. These have been thought out. So it's really, really important. And Sandy, what are your thoughts on it?
I think this is going to be a great episode. I'm in a lot of different Facebook groups. I'm on Dental Town. People are talking about membership plans. They're curious. I know when I go and have my lectures, my Front Desk Pro lectures, which I have one coming up in Boston in August, by the way, listeners, but people are always asking. And of course, I do talk about Plan Forward because I'm very familiar with membership plans. I can remember 10 years ago when people were coming up with this idea to have membership plans in their practice. And they were doing it all like they were like literally carrying around a folder. Like, oh, yeah, here's our membership plan, Sandy. No more. I've looked at these different ways to track it. I remember the first one that came out, Plan Forward. Guys, if you haven't seen what they can do with your membership plan, whether you have one currently and your team is spending countless hours trying to organize it and deal with it and run payments, you've got to look at Plan Forward. Or maybe you're a new practice or existing practice and you've never implemented one. You need to contact Plan Forward. And I think after you listen to today's episode, you'll say, yeah, you know what? She's right. I need to do this. A lot of times, practice owners and even team members think, oh, that's just for people that maybe can't afford dentistry. And so we need to do this for those people. Is that a myth, Megan?
That's a myth. Early on in my membership plan journey, starting Plan Forward in 2018, that was like what everyone thought. So this is really for low income who maybe are right above the Medicaid level for people who can't afford dentistry. So immediately the thought went to like, gotta reduce my fees so low. So, we can make this affordable. And it is absolutely not the case. I'm not saying that there aren't practices who serve that demographic where you might need a plan that is at that level if you want your patients to be able to access it. But you guys, half of the American population does not have dental insurance. And there are so many people in affluent areas and retirees that have plenty of discretionary spending money. They just simply don't have dental insurance. There are fee-for-service practices and practices in affluent areas and cosmetic practices that do all types of big treatment cases. You implement these plans and you price them according to your patient demographic. And it's not simply for people who can't afford dentistry. It's making dentistry, the pricing transparent and bundling things according to your standard of care. So you help these patients stay on track with what you're prescribing for them. That's what you're doing. And you're really kind of tying a bow on it and making it marketable.
I love the way you put that. It's so true. And then you look at half the people don't have insurance. And then you also look at how many people don't go to the dentist every year. Those people without insurance, they're the ones that need the work. So when you make it easy for them, it just makes sense, right?
Yeah. No matter how you look at it, a lot of people think dentistry is expensive. And people can be a little bit anxious about going to the dentist when they don't have insurance. They have no idea what things should cost or what they should be paying, or if you suggest an extra PA or if you offer them fluoride, it doesn't come with a rate sheet. So they know how much these things are when you're proposing it. So it just makes everything transparent and you help them say yes.
I love all of that. But I also think that so many practices don't understand how membership plans work. And one thing I hear a lot, in fact, I have a client that mentioned this to me recently. I think he finally did reach out to you guys. And he was saying, I don't know that I want to discount my fees for patients because that'll lower my revenue. And I want my revenue to go up. So
Yeah.
can you explain how that works?
That's like myth number 2, and probably the number one thing, honestly, that people think is, will my revenue decrease if I offer a membership plan to my uninsured patients? Because we're not sugarcoating this. You are going to give discounts to incentivize these patients. There's got to be a reason for them to join the plan in exchange for kind of their loyalty. But here's the thing. If your recall rate for your uninsured patients is nearly 100%, then I would say you probably don't need a membership plan, in all honesty.
I've never seen that. Okay. Nowhere near that.
So we've been integrating and looking at data across practice management systems from real practices. And you guys, the uninsured patient population is not coming in according to the 2 times a year or 3 or 4 perio visits. They're just not. They're stretching it every 9 months, 12 months, 18 months. While you may be collecting your full fees, you might. That's another thing that people don't do. When we look at the data, uninsured patients are not coming in regularly, and practices are writing off the X-ray or giving a 10% courtesy discount or not doing bite wings or the Pano or the FMX that they really want to do. And patients aren't taking fluoride. And so you may have in your mind that my uninsured patients come in regularly and pay my full fees and accept my standard of care. But just make sure that your data supports that. I've literally seen one practice. It was a high-end perio maintenance practice in Manhattan. And this business manager was so on top of it. And he said, our recall rate is 95% because we invite them to find a new practice if they can't comply with our standard of care. And so I thought, to be honest, you probably don't want a membership plan. Because if you're able to do that and collect your full fees and your recall is that high and you know that with the data, then by all means, don't. But for 99% of practices out there, uninsured patients are just not coming in. They're not saying yes, or you're giving ad hoc discounts willy-nilly. Either the front desk is making the decision or the doctor's like on the fly. Sure, discount that, give them 5%, give them 10%, whatever. Trying to get the uninsured patients to say yes. That's the anecdotal side. From the data side, we know that uninsured patients are spending 3 times more in a 12-month period and accepting that much more treatment than uninsured patients not on a membership plan. So while from a unit perspective, every single service may be discounted slightly, if you do a thorough pricing analysis, you may not have to bring your fees down quite as much as you're thinking. Especially for your bread and butter, your exams, cleanings, x-rays. You can get pretty close to UCR depending on where your UCR is. If you're adding other things and offering, a 10, 15, 20% discount on treatment, it kind of all depends on what your PPO, your fee schedules are, your reimbursement rates are. I mean, there's a lot that goes into pricing, but high level, your revenue, your total collections, and your production will increase for every membership patient you put on your membership plan compared to your uninsured patients not on a membership plan.
So it will increase then.
It will increase.
If I could ask, what have you seen most people add extra to it to make that happen?
For sure, the emergency visit, emergency exam, and x-ray at UCR can usually be about $150, out of pocket for an uninsured patient. So when they include those, we know like 3% of patients actually use it within the 12-month period. But when they add it in, it takes that hesitation away from patients coming in to get seen when they have a problem. And most times they're going to need some sort of treatment, obviously, if they come in for the emergency. It's definitely the best value add. Include the emergency visit. Fluoride, it depends if you're getting reimbursed for adult fluoride. We look at your cost on fluoride, but for sure include fluoride at every visit if you can and if it makes sense. That's a huge value add. It's a low cost item compared to the value that patients see. I mean, I'm seeing fluoride anywhere between $30 and $60 per application at UCR rates. 2 fluoride visits, there's $100 in value right there. People are including things like 50% off sealants for children, like first application, because those are so expensive without insurance. Athletic mouth guards, sometimes people can make those pretty quickly. And for kids or people who need athletic mouth guards or bite guards, Those are usually pretty high margin, low cost. So things like that, that you've got a good margin on, are great ways to add value to the plan.
You have done like your homework. You really understand. Unlike some of these companies that I've seen, it's just like people are hired outside of the industry and they come in and they just don't know their product like you do. You're very impressive. I just want to say that's another thing that I really admire and like about Plan Forward. You have simplified things, which brings me to that next myth that people say, I bet it's really complicated to implement something like this. And what do you say about that?
We do all the heavy lifting, and I'm not here just to say, you have to use Plan Forward. When you break it down and think about the core things you really need for the plan, you need pricing that makes sense and bundled services that make sense for your patients. You need a way to track it in your practice management system, and you need to be able to pull reports to show your production and your collections for things like compensation. If you go all into, we got to get it on our website, we got to get the marketing materials, what's the legal side? There are a lot of things to check, but there are lots of people. Sandy, I'm sure you've done this a million times for people and helped them just create plans, themselves. There are steps. That's what we're here for. And when you look at the data and when you look at how much more revenue you can generate from the membership plan and more treatment acceptance, it takes that complexity and it puts it into perspective. And
what about like all the admin time? Oh, the automation.
That's what the software's for. Maybe we should jump down to kind of the last myth on our list. Software and technology. I know people are afraid of it because there's a learning curve and it's just another thing. It is there to make your life easier, and it is there to make sure that this program, when it's not in a software, it relies on Susie at the front desk or Sherry, the treatment coordinator, to make sure all the manual alerts and steps are in the PMS. And then we got to remember to renew. And then do we notify our patients before we renew? And all these things that are reliant on one of your team members. You've got to remove that. If you really want this plan to be valuable to your patients, and you want them to have options, and you want multiple plans so that you're serving your whole patient demographic, you've got to have a better way to give them options, to have the appropriate plans in place, to market the plan, and to track things. You really need a system to do that.
That is so true. I've seen it firsthand. I've seen those folders that I was talking about. Oh, wait, let me find it. And yeah.
It was me.
Yeah, you have been there. I have trouble getting team members to do basic things like recare, much less this.
Yeah.
And it's so important. So another myth that we made note of is patients will they be interested in this?
Patients want answers and they want to understand what you're offering. And so patients will understand it if you present it in a way that makes sense. So number one, don't price your plan above UCR because you're giving a discount off treatment. Because in a patient's mind, they're adding up things they think they need, which is exams, cleanings, and x-rays. Probably not even fluoride. They're going to add up your UCR for those things. And if your plan is more expensive, you've given them like a decision. And so I wouldn't recommend that. I would recommend making the plan such a no-brainer and having materials that easily show this is how much my plan costs. This is what's included. This is how much it is not on the plan. And there's an obvious savings. You get a perk of, discounts on treatment. So they will be interested if the plan makes sense. And if you have a brochure or materials that show them the value.
That's the main thing. Do they really understand it? Let's say they start asking questions. They might even wonder, like, is this the same as a traditional insurance? Some people might even drop their insurance if they're paying for it personally.
Yep, absolutely. We had a lot of patients do that. I know the options for retirees have changed since I was in the practice 12, 13 years ago. But I remember those were the plans that patients were paying $40, $50 a month, and it wasn't even covering their routine preventive care at 100%. Or, buying discount plans where they're still paying a la carte at the practice, plus another fee every year to re-up. There are these other options. When you look at traditional insurance, what you want them to remember is how much are you paying out of pocket in your premium? And how much have you paid also out of pocket in that same term for services? So add up the premium and add up how much they paid out of pocket. And that will help. It's not your job to sell the plan. Your job is to give them information for them to make the best decision.
A lot of them don't even know because it's taken out of their paycheck, an automatic deduction for their portion. And whenever you do that, it makes them look and they go, oh, yeah, okay, I didn't realize that.
Some of these plans, even employer-sponsored plans, if they're paying $25 to $30 a month out of their own pocket, plus they have a max of like $750 or even maybe $1,000 with waiting periods and exclusions, there's a good chance your plan can really compete with that.
The insurance companies are looking for ways not to pay. Let's face it.
Yes. I have a snippet. We did like a coffee chat with one of our clients, and she's like, guys, I don't even let my team say insurance because no one has insurance for their teeth. It doesn't exist. There's a benefit. Sometimes the benefit plan offered by the employer isn't the best bang for your dollar. It's the best premium they could find to offer you a benefit. So just do the math on the premiums and the out of pocket. A lot of times we're hearing, because it's so hard right now with little leverage for practices to renegotiate those reimbursement rates, a lot of people are going out of network.
More than ever.
More than ever. Yes, more than ever. So this conversation, that's what we train on, especially during open enrollment, is like how to have these conversations confidently. This is what you need to look at. This is what you need to add up. And this is what our plan is. You make the decision.
It's not your job to sell the plan. It's your job to give the information. And then they make the transition on their own.
And it's our job to help guide you in making sure that your plan makes total sense.
And so what about to the listeners? I know because I've had people like, what about regulations?
They do. They vary. It's the direct primary care regulations that regulate membership plans. And it is state by state. Usually they make sense and they're there to protect consumers. They're there so that businesses or practices aren't roping people into contracts and then the patient doesn't get their value, or what if something happens to the business? I mean, they're there for a reason. And usually for most states, they make sense. You just have to know what language to put in the member agreements. You have to know termination policies. Those are the things that usually vary state by state. Or it's a gray area where the state doesn't yet have direct primary care regulations written. So it truly is a gray area. It's not against the rules, but it's not also permissible in black and white, and here are the guidelines. So that's where it gets gray. There are very, very few states. Washington State is really the one where it's a challenge. They specifically have regulations around no auto renewal, and you can't really have a traditional membership plan in Washington State.
But you have clients there.
We actually don't take clients there.
Really?
Yeah. You really, at this point, need a special license to do really a discount plan in Washington State.
Okay. That's interesting. You see, but there's another advantage to you guys. You get familiar with it. So
we review it on an annual basis. And depending on where your practice is, when your member enrolls, that member agreement that your patient is signing, all that information is merged into that agreement and they sign it. And that's your leg to stand on. That's also another important thing when it comes to regulations. You got to have them sign something. So you have a leg to stand on that you have permission to do this.
This is good stuff, I'm telling you. What about when a practice is paying a provider based on production and then there's this plan that comes in and it's reduced? How does that work? Tell me about that.
So compensation and bonuses is where we have a lot of conversations with teams because their immediate mindset is, the practice management system is set up for insurance or cash, where you have a data service, services are provided, and something is charged, and a payment is applied to that data service. That's how the systems are built. Membership introduces a new accounting flow. Either you're getting it all up front, and then somehow you have to figure out, quantify how much collections is for each provider or how much adjusted production is for each provider for each service, or they're paying monthly. So you have little collections coming in all throughout the year. So the way we built our system is so we can track and allocate a portion of those collections in the adjusted production when services are completed so that you can run your reports and compensate just the same as you would for a cash or an uninsured patient. That's the key takeaway. Even if you don't use a system like Plan Forward, make sure, however you're tracking it in your PMS, that your team is compensated the same and you're able to show the value of that adjusted production or collections for those providers. One of the biggest way to disincentivize, your hygienists is to zero everything out and then they don't get any production. Even if they're paid hourly, usually the team or they're bonused or incentivized on a production goal. All that hygiene production and not adding it back into total production when you're figuring the bonuses, they're not going to want to grow or promote or talk about your membership plan, even if it's in the best interest of the patient. And same with the doctors. If you're collecting yearly and that first doctor gets it all, or you're not comping your doctors on those periodic exams or limited exams or comp exams, the doctors aren't necessarily going to want to be excited about seeing those patients. You have to make sure that the compensation and the reporting is in alignment with how you're compensating all your other types of patients. And there's ways to do it too in the PMS. You just, until these systems come around to, 2024, where this function needs to be in the PMS and the accounting is supported, then it is adding things together, your membership stuff and your other stuff, so that the total production or total collection picture is considered with compensation.
Very good. What about when they just think, oh gosh, yeah, I hear this one with a lot of things, not just membership plans, but in general, that's never going to work with my patients or my practice.
Yeah. And a lot of people have started a plan or tried it and, they didn't get any traction. So that's the thought. It doesn't work.
I think this is common in dentistry. And one thing I figured out is there's not a big difference in a practice that's over here in California versus one that's in Chicago or North Carolina. They're really not that different.
It's true. I think it comes down to a mindset of leadership and how much of a priority this is, or a talking point. Is this a priority of the practice? Does everyone understand why we're doing this? And that it is good for our patients and it's good for the business. And then making sure the team has a system and the verbiage and the support materials to present it to patients in a way that is compelling. And they're like, yes, sign me up. All of those things have to happen in order for this to be something that everybody is on board with. And I promise you, if you've done it in the past, either pricing was all wrong, the materials were terribly confusing. Oh my gosh, quick story. There was a practice not far even from my house. It was early on. The doctor was fuming when she called me. She's like, my team, I spent so much time and money and effort and energy creating our plan, and our team just will not sell it. After she was done, 30 minutes of telling me how bad this situation is and why this won't grow, I said, send me your materials. Let me just look at your plan. And when she sent it to me, I understand dentistry. And I'm looking at these materials and I was so confused. And I'm like, it's not the plan and it's not the team. It's not that they don't want to promote it. We just had to repackage, restructure, retrain, and they quadrupled the number of members in the first 12 months. The team loved having the option. It was so confusing for patients and it was taking so long to explain things that no wonder why they didn't want to talk about it.
Presentation is everything. And we talk about that a lot of times just with treatment presentation, right? It's everything and following up.
Yep. Well, a lot of times this is when the membership plan conversation happens, is during the treatment. And so the patient's already probably maybe a little overwhelmed by how much treatment they have. Who knows? But it's really dependent on, yes, how you present, how confident you are, and how easy it is for the patient to understand it.
Totally agree.
Real quick, Megan, have you ever gotten any pushback from a team member on this?
Yes.
I bet.
Yes.
How does that go?
With every type of team member. There's a lot of times where there's misalignment early on, where the doctor wants this so much. They see the value. Maybe their friends are doing it. They've listened to podcasts. Sandy told them to do it. But that office manager is just opposed, or the treatment coordinator is opposed and is just stonewalling it. That's hard. It's still our job to get everybody nodding and rowing in the same direction. Or it's the opposite, where the administrative team, the office manager really wants it because that person's having the conversations with the patients. They want a solution. They know there's a need, but the doctor's afraid they're going to lose revenue, or the doctor doesn't know how to set it up or isn't confident how to price it. There's misalignment there. It happens all the time.
It's mostly because they don't understand.
Yeah.
Like they don't have all the data. That is generally what happens.
If I can give one piece of advice, we rarely, from what I'm told, have the whole team, including the doctor, on a demo. But that is your chance to get all the information and to ask questions. And so we do lots of demos with the office team, and they're all super excited and love it. And they don't talk about membership plans or sell membership plans for a living. And so they can't regurgitate everything that just happened in the demo to the doctor. And so that's one of the biggest challenges too. Or if you're curious, get on the demo, even for 20 minutes, get on the demo or ask for a recording and get the information before you just say no.
Right. Well, I can't think of any negatives. Whenever I looked at you guys in the beginning, I was blown away. I told you that compared to anything else out there, it's a no-brainer. But I do have one more thing, another myth where people are saying, I don't need software to do this. I can do this on my own. So what do you say?
Technically, you're right. Like you can do it, but you have to look at the missed opportunity. And that's what is hard to calculate. How much revenue are you missing because you're not renewing on the renewal date? How many services are you giving away because you didn't know they should have renewed, or you didn't know they already used all of their cleanings and they came in for an extra, or they already used their emergency? Like, how much are you missing, losing out on, or it's not growing because you don't have the right system and process in place? Even if you have 20 to 30 patients, you can probably check the box and manage that on an annual basis. But again, it's not scalable. It's not scalable at that rate. You have probably 25% of your patients right now, low-hanging fruit, that don't have insurance, that are in your PMS and are active. And so if you have 20 people on your plan and you have 25% uninsured, you don't have a good plan in place. Your plan is not really working for your business. That's where this starts to shift, is make this plan work for your business. This isn't just a discount for patients. You need to start seeing business, recurring revenue, increase treatment acceptance, increase production per visit, increase visits per patient. Those are the metrics. We just did a fabulous annual review for one of our DSOs, and they were like, wow, this is really going in the right direction. And we give them that information on an annual basis. If you don't measure it, you don't manage it. Measuring your lost opportunity when you're doing it manually, no. You're just checking the box and dealing with whoever is in, on the phone or at the desk at that time. But really, to make business impact, to be able to grow your practice through membership, which is really where a huge opportunity is, you need a software. And when I think about, nobody wants to pay for anything, and I get that. Nobody wants an added expense. We don't want added expenses. I can't tell you how many SaaS products we use that we pay for. Zoom, Adobe, QuickBooks, like all the things that we use, there's an expense. And for us, we have to keep you compliant. We have to keep your data secure. We have to keep all of these I's dotted, T's crossed. We have to keep innovating. You want integration. We want integration. That stuff comes at a cost. So naturally, there's going to be a cost. You have to kind of weigh that cost benefit analysis. And if you have 20 patients on your plan and you think it's checking the box, then maybe you don't need software. But I'm in the camp that there is a massive market, a big opportunity. And if you want to create revenue that's independent from insurance and really have an opportunity to grow profitably, you need software and you need to have a good membership plan in place.
Oh, I love this. I love this. And you know what? Just think about the inefficiencies, the mistakes, the staff time if you don't have the software. And overall, when I think of Plan Forward and when I'm talking about patient retention, in my lectures, that's when I bring up Plan Forward, because it just is a no-brainer for patient retention. When I'm seeing patient retention at 50 and 60% in practices, and then I see with Plan Forward, they're prepaying to come back.
Yep.
Makes sense.
Yep. It is so much cheaper to retain your existing patients than go get new patients. So retain them.
Real quick, where do you see, Megan, people hit the wall when they're doing it on their own?
Like how many patients?
Yeah, like how many patients, or typically whenever they are encounter this procedure or this happens, or this many team members or new patients as well, or how many patients? And then after that, it just momentum slows down.
I haven't been on kind of the sales team in a while, but I feel like people start to reach out and start asking questions between 50 and 100 patients. When they have about 50 or 100 on a plan that they're running manually, it tells us they get the value. Their patients are saying yes, they're doing something right, but it's to a point where like they've felt the pain of they have the administrative challenges because they have enough patients on it. If you have 20 patients, you probably aren't there yet. You're not feeling the pain. For startup practices or like new acquisitions, doctors coming in wanting to like improve things, that's also where we get it. And I love new practices who like starting fresh, don't have a plan in place. I mean, that's a perfect time. And you know what? Don't go with the integrated product. Start simple, start just, with our essential product. We'll help you check all the boxes. We'll get the plan up and running in 2 to 3 weeks. And it'll be well thought out. It'll be yours. It'll be branded. Your team will be trained. And you just, start enrolling. Then once you grow your plan and you want to start really measuring and seeing metrics, add on the integration, and then we can start to have some fun with your data.
I love it so much.
I love you, Sandy, and you, Michael, for like all your support. I mean, I am so passionate about this. I can't believe that people are not on the train yet or haven't heard about membership plans yet. I mean, that still just boggles my mind.
Because you're seeing the successes.
Yeah, I do.
Yeah, that's wonderful. Megan, any final pieces of advice that you'd like to give to our listener?
I think just get the team on a demo. That's my biggest piece of advice is if you're not doing it, or even if you have a solution in place in-house or whatnot, just bring the team, do a demo, and just learn, just consider. And I know there are a million other things you can consider too. There's lots of other things going on, but this is a real opportunity to grow independently from insurance and grow profitably. And it streamlines a lot of your ad hoc discount conversations. I mean, it's either if you don't have insurance or you don't take insurance, you can pay our full fees or you can join our membership plan. That's it. That's the option.
Yeah.
All right. I love that. And then Sandy, any final words for this episode?
Well, I think it's a no-brainer for our members, our listeners to contact Plan Forward today. Get a demo today.
So that's going to be in the show notes below. And if you want to talk about this episode, come on the podcast or submit any questions, then you can do so by joining the Facebook group Dental Gumbo. And in there, you can talk to us and see more advice and suggestions that Sandy has for your front office and your team. And you can talk to Megan. She's in there.
I'm in there.
So definitely talk to her. If you have any questions about this episode or any membership plan questions just in general, she can definitely answer that. So thank you all so much for tuning in, and we'll talk to you in the next episode.
Bye, everyone.
Thank you. Bye-bye.